Tonight, the numbers. 914 measles cases around the country, 762 of them in Auckland. Scrapped the New Zealand Secondary Schools Rugby League Championship in case its players get or spread measles. Activated today, the National Health Coordination Centre to coordinate the response to the outbreak in Auckland and monitor the situation elsewhere. The fear? The outbreak will worsen, and there's the possibility it could be fuelled by thousands of secondary students gathering across New Zealand for winter sports tournament week on Monday. Andrew McRae reports.
The National Championships was due to start on Monday in South Auckland, which is home to more than 500 of Auckland's measles cases. Teams were due to come from around the country, and New Zealand Rugby League's Wellbeing General Manager Nigel Vangana says it was too risky to go ahead.
I'd say there'd be a lot of disappointed kids out there missing out on this opportunity, but unfortunately it was out of our hands and one that we sort of had to do for the people of the country, really. So we didn't want teams travelling up from the South Island, potentially getting crook or one of them getting crook and taking it back down there.
The measles outbreak has been on everyone's mind ahead of the Winter Sports Tournament week, which starts on Monday. That was scheduled to involve 79 secondary sports championships with more than 20,000 students across New Zealand. The Chief Executive of School Sport New Zealand is Gary Carnahan.
We have discussed with a number of schools who are saying that they have a number of non-immunised students that might make their team non-viable, and so they'll be considering their positions individually around that.
At Rowendale School in McRae, South Auckland, 170 of its 600 students have been away as there was doubt over their vaccination status. One staff member is off work with the disease. Assistant Principal Lois Hawley-Simmons says information from Public Health has until this week been sadly lacking.
We had our individual teachers contacting their own immediate medical centres and getting different stories.
She says closing all schools in Auckland for a period could be an option worth considering.
Would it help? I don't know, to be honest, but we have to consider almost all options before that comes to that decision.
Lois Hawley-Simmons says her school is in self-imposed isolation.
We had the sign up, we had the big sign out at the front of the school on our board. Please note that we are asking our agencies not to come in if you're not immunised or as a precaution.
The Auckland Regional Public Health Service says anyone with any symptoms of measles, including a cough or runny nose, should not be included in teams. And it says schools should request proof of vaccination for any student and parents under the age of 50 who are travelling with them. At the domestic terminal at Auckland Airport, most people say they're aware of the measles outbreak in the city. T. Longman's travelling with her husband and young daughter back to Tauranga.
Yes, very worried. That's why we're sitting outside.
Have you all been immunised?
Yeah, we have been. Not the baby, no. She's only 9 months, so she's too young to have her first shot.
Pregnant mum Jazz Kupu says she's more worried about herself than her 2-year-old daughter that she's travelling with.
I'm not immunised, but yes, my daughter is, yeah. So she's safe, I'm not.
And why is that?
Because me and my kids in my stomach now can catch it if we actually do come in contact with it, yeah. And we could get seriously sick.
Around the country, the number of reported cases of measles varies from 4 in the southern DHB area, 41 in Canterbury, 26 in Northland and 3 in Waikato. The Waikato Medical Officer of Health, Richard Hoskins, says because of the close proximity to Auckland, it's inevitable the number in his region will rise.
The longer it goes on in Auckland, the more likely we are to get more cases. And then, of course, we've got unvaccinated people in our community, so the cases we've already got could be passing it on to other people.
The National Opposition wants to see more resources to tackle the worst measles outbreak in more than 20 years. Its Associate Health spokesperson, Dr. Shane Reti, says the country has taken its eye off the ball when it comes to the seriousness of infectious diseases.
I'm pleased that we're starting to take the vaccination service out to the people. I think it can go further, and so I'd like to be seeing more resource applied to this. Not clear to me that we've reached the peak in this outbreak at this point.
The Prime Minister, Jacinda Ardern, says the rollout of additional nurses to provide more measles vaccinations will help.
My strong advice to anyone is make sure that you're vaccinated, make sure that you're not relying on simply not having contact. The smartest, safest thing to do is to be vaccinated.
Tomorrow in Auckland, vaccination clinics will be set up in Manukau, the Clendon Shopping Centre in Manurewa, and at the Free Church of Tonga in McRae. For Checkpoint, ko Andrew McRae tēnei.